Okay, welcome everybody. Welcome back. Hope you all have had a very nice lunch. Because the previous session was running a little bit late, we've started about 10 minutes later as well. But we'll use the full hour because I think we've got a very important matter at hand this afternoon. So we're talking about mind matters and we're tackling the mental health and the SSC journey. So thank you all for joining, also at home and for people who are going to be translated to. So thank you very much for attending. And thank you to my panelists as well. We've got 3 wonderful speakers who will talk from their own perspectives on this issue on mind matters. And I am going to introduce them in a little while, but would you mind putting the slide on for the housekeeping rules? So please keep your phone on silent during the session. We're going to keep eye on the timekeeping ourselves as well, but if you have a very difficult question, maybe you could ask later outside of the session. There will be the session and also the questions and answers will be translated, and there'll be a coffee break later. So, welcome everybody, and I would like to give the floor first to Linda Kwakkenbos. Linda Kwakkenbos is a researcher, and she's also the co-director of SPIN, which is called the Scleroderma Center Initiated. Sorry, I'm really sorry. I'm a little bit nervous, so excuse me. I think she'll explain herself what her function is exactly. So the floor is yours, Linda.
Thank you. First, I need to find my slides. So thank you very much for the introductions, and it's nice to see so many new faces as well as familiar faces, and I'm happy to reconnect with many of you today here and speak about what psychologists, or from a psychological perspective, we can do to help you deal and cope with the challenges that may be posed on you by scleroderma. So I'm Linda Kwakkenbos, and I'm an assistant professor at Radboud University in Nijmegen in the Netherlands. And I work there in the Department of Psychology, and I'm the co-director of the Scleroderma Patient-Centered Intervention Network. And for some of you, this may be very familiar already because we've been existing for almost a decade now. We also have a table at the front here in front of the coffee if you would like to learn more about our project, and I'm going to speak a little bit about it here today. I also would like you to leave with some tips and some tools on how to deal with worry and what you can do to empower yourself to deal with the challenges of scleroderma. I have nothing to disclose. So in SPIN, it says Person-Centered, Patient-Centered Intervention Network. And I think in the last decades, we've kind of like moved away from just looking at a patient from a biomedical perspective towards looking more at a person with a certain disease. So we moved away from the biomedical model where we just looked at a person who is having a disease, a patient, towards more seeing a person in contexts. And we've done that maybe as ourselves, as people, or you as yourselves, as people living with a disease, but also in the medical field. So now, if you look at medical research, medical interventions, we're looking at people from a biopsychosocial model in a certain context. So not just looking at the biology, not just looking at the physical health, but also at mental health and your social network. And we've also started to look very differently at what it means to be healthy or what it means to be ill. And my first question to you is, have you ever thought about how you actually define health and how you define illness? Because that may be very different in how you cope with your disease, how you deal with the challenges of scleroderma. In the medical model, it's one of the oldest models in health research. Health is the absence of disease, which basically means that once you have a disease like scleroderma, you can never be healthy again. And it's still very strong and powerful, and people still see this as a useful definition. But there's also a definition by Machteld Huber and some other researchers from all over the globe that are looking more at positive health. And positive health is defined as the ability to adapt and to self-manage in the face of social, physical, and emotional challenges, which basically means that there's things that you can do yourself to adapt to the disease, to self-manage your disease, and to feel more healthy again. And I really like that, because we're not focusing on coping with the disease itself, coping with the symptoms, but we're starting to focus on well-being, on things like quality of life. And we're looking at concepts such as resilience. How can you manage your disease to live the best possible life despite all of the challenges? Because there's a lot of challenges in rare diseases, also in more common diseases, but there are specific challenges to living with a rare disease such as scleroderma. It's, first of all, difficult to get an accurate diagnosis. You know more about this than I do, I always say. And then once you're diagnosed, there's not a lot of effective treatments and support programs that may be available in more common diseases. And when I talk about these the treatments, the support programs, I'm not talking about the medical treatments. I'm talking about things like physical rehabilitation, psychological support to cope with your mental health, patient education, as well as self-management tools. And in more common diseases, medical care most commonly already includes this. So there's specific challenges to living with rare diseases and to living with scleroderma, because these programs are not available. And luckily, they are becoming more and more available. And SPIN, the Scleroderma Patient-Centered Intervention Network, is, I think, playing a really big role in that. And our mission in SPIN is to really work with people with scleroderma, to identify their needs, but also to set some priorities. What should we focus on first? And think about what is most important to you as people living with the disease. And in addition to better understanding that, identifying these needs, we also want to do something about this. So we're trying and we're working to develop and test, but also disseminate, so make available patient programs that help you with physical rehabilitations, self-management, and that help you improve quality of life. And we're quite a large network of research centers, patient organization partners, physicians, who all work together to do basically two important things. One is this understanding the needs, understanding factors that may contribute to domains of quality of life, as well as building and testing these tools. So we're working with many organizations from all over the globe, and this is still expanding. I hope that this is an up-to-date slide. I'm looking at my colleagues in the back. But basically, patient partner organizations and over 50 clinicians from different countries. And what we do is we build the SPIN cohort. You may have heard of this, but the SPIN cohort, a cohort is a group of people who we follow over time, and we ask people with scleroderma who are enrolled through their physician to complete online measures on quality of life, on physical health, on their mental health, every 3 months. And by looking at that over time, we're trying to identify what factors may contribute to fatigue, what factors may contribute to physical health, and what factors, of course, we're here talking about mental well-being, are contributing to better or worse mental health. And we have a cohort of over 2,500 participants, over 50 clinical recruiting sites in 7 countries, and we're doing this in 3 languages, English, French, and Spanish, and we're looking still to expand that to other languages as well. So together we have a very powerful base to build programs to identify needs of people living with scleroderma. And the other part, as I just said, is that we are building tools. And here's a quite big list of different tools that we are working on and have been working on. During COVID-19, we actually put together a home, we call it SPIN Chat, COVID-19 Home Isolation Activities Together program, and we were able to support people during COVID in dealing with the disease and the mental health challenges such as stress, loneliness, and worry that may have come from it. We're also working to train support group leaders to have more local support groups. We have finished our SPIN Hand program, that is exercises for hand limitations, and it's available free of charge online already. And of course, we're working on self-management and coping with the emotional challenges of living with scleroderma. These are not all out yet, but we're working on it steadily. But we're here to talk about mental health, and I first wanted to go over what mental health is, because I feel like we all have kind of like an intuitive intuitive image of what mental health is, but also what mental illness may be. So first, I put together this, I don't know if you can see the colors, it's almost like a traffic light color, in which mental health is when you have the capacity to think, feel, and act in ways that you can enjoy life, deal with challenges, and also, if you're mentally healthy, it's not that you're not suffering losses, but you're able to pull yourself back up again. Then the orange one, it's mental health issues. So there's diminished capacities to actually enjoy life, to interact with your society and with our environment, but also to rebound or to recover from challenges that we are facing. And then on the red, there's mental illness, which is what we know typically when people need to see a psychologist. They may have a depression or anxiety disorder, and that's really affecting your thinking, feeling, and your behavior. So it's quite a scale from being mentally healthy to being mentally ill. So what do we know about scleroderma? Francesca has done a study, but we've also done some studies in our team in Montreal. And actually, if you look at the percentage of people with major depressive disorder in scleroderma, so those are in the red zone, we see that approximately 4% have a 30-day prevalence of major depressive disorder, which is about 3 to 4 times as much as in the general Canadian population. And you can say 4%, that's a lot if you compare to the 1.3% of Canada, but it also means that 96% of the people we interviewed did not have a major depression, which doesn't mean that they may not have had mental health issues, like the orange zone that we were in. And actually, if you look at how many people who had major depressive disorder still had it 30 days later, a month later, only 25% of those people still had major depressive disorder. And this is not to say that scleroderma isn't burdensome, that it may not impact your well-being and your mental health, but I think looking at these numbers, there's also a lot of resilience. There's a lot of people who bounce back within a month from major depressive disorder, and many of the people who talk about stress and illness are not in the mental illness, but they're in this orange zone of mental health issues. And that's where we can actually provide support for you as well. So what can we do? Right? I'm sure that you probably want to leave here with some tools, and I already said that I would give you some to actually improve your own mental health. And 15 minutes is just not enough to go over a lot of things in detail, but I do have some helpful tips. And speaking with a few people, I thought that it would be worthwhile to focus on worry. Because worry is something that you may recognize as something that is normal. Sometimes you just worry and you're just concerned about something. But if this worry becomes excessive, then a really important problem is that it interferes with your life right now. You may worry about something that might or might not happen in the future, and it's actually reducing your quality of life right now and interfering with what you would like to do right now. So maybe that could be watching a movie or reading a book, etc. And I don't know how many of you have tried it to just think oh, I shouldn't think about this. Just stop worrying. It doesn't work. It doesn't work. As much as we would like it to be, we cannot just stop our mind from worrying. And I would like to tell you a bit about 2 types of worries. One is real problem worries, things that are actual problems that are affecting you right now. You can see it here on the slide, my children are off of school and I need help to look after them. It's an actual problem right now. Makes sense to worry about it because it's something that is happening right now. But then we also often have a lot of hypothetical worries. So those are worries about things that do not currently exist, but that might happen in the future. So we're thinking ahead of things that might happen or maybe not. What will I do if I lose my job? Or what if I end up on a ventilator from scleroderma? And there's actually a different way of dealing with these 2 types of worries. And the first step, of course, is to start to recognize them and to figure out, what am I worrying about in the first place? So start up here. What am I worrying about? Is it a problem that I can do something about? If not, so the red line here, then it would be good to let go of the worry and focus on something that is important to you right now. And now you may think, like, how am I doing that? And I'm going to tell you that in the next slide. Is it the problem that you can do something about that? Then work out what you could do and then do it, right? It sounds easy, but if you've identified that this is a problem right now that you may be able to resolve, you can resolve it and let go of that worry. Is it something that you can do, but you cannot do it right now? Then again, plan what you can do and when you can do it, and then try to let go of the worry. And the way that this works, or a tool that may help you with this, is actually, we call it scheduling worry time. And scheduling worry time may seem a little bit awkward at first, and you may wonder, like, how am I going to do this? But basically, you'll take a little journal, and you will write like all of these worries that come to mind when they come to mind. And you just put them down on paper, leave them be for the time being, focus on the things that you want to do, and then actually you will schedule a very specific time during the day that you would look at those worries. But not just worry to ruminate again and to think about them again, but you're asking yourself the question, how can I resolve this, right? Like, how can I make sure that this problem is getting resolved? And it's a much more problem-solving approach to worries, and it may feel very arbitrary at first because you're kind of like putting things down on paper and you're getting back to it later, but this is actually proven to be working in reducing worry and in getting things done. So here's an example of a worksheet that you can use for that. For instance, a thought may be, what if I'm not feeling well enough to help my daughter with her homework tonight? You know, you can be very concerned about that. It may be an actual worry, maybe like a hypothetical worry. And then the how can I thought is thinking, how can I plan ahead so that my daughter actually gets the help that she will need with her homework tonight? And then there's the third column, like over here, there's possible actions. And these possible actions may be like, I rest while my daughter is doing her readings, and then I can help her after with trying to ask her some questions about this. Or maybe another action may be, if I don't feel well enough, I can ask someone else to step in, such as my husband. And these kind of like worksheets and having the scheduled worry time will reduce the worry in the moment, but especially the interference that it has with things you would want to do at that specific time. And you're taking a more problem-solving approach to trying to reduce your worries. But this is just one of the tools and techniques that you can think about if you think about self-management. Yeah, I'm going to wrap up. Yeah. So this is an example of tools that you could use in terms of like self-managing. I've also put another slide together with some tips and resources, and I thought I would not have enough time to go through them in detail. But there's things about adopting a healthy lifestyle, peer support, emotional support, information, as well as tangible support, like maybe someone cooking for you, but also just like talking with others, asking for help from your care provider, and maybe a referral to a mental health specialist. There may be local or e-health tools in your environment, and again, I've put some links here that you can use. And also read up information from trustworthy sources. Just seeing if anyone is taking another photograph, and then I'll be happy to share the slides as well, of course. All right, then thank you very much for your attention. If you would like to follow SPIN, we have a website, a Facebook, an Instagram, and also please follow or see us at the table. Thank you very much.
Oh, that was yes, we're open to questions. First, I would like to thank you for your really wonderful talk, because it's given some really useful tools, and I saw people taking notes / taking pictures. So I think it fulfills a need. So thank you very much.
Thank you. Thanks.
Is there anybody in the room who would like to pose a question to Linda? And if not, I've got one.
There's one.
There is one, yes.
Is there done any research? In my belief, I think the more severe a condition affects us, we get new normals. What was normal for me 2 years ago, I can't do today. That makes me adapt to new normal, and I'm happy more happy with what I can do today than what I've lost 3 years ago. Is there any research supporting that?
Yes, there's actually, that's an excellent question. So the question is whether there's any research supporting that what you're looking at right now, what you can do, is different from what you thought you lost like 3 years ago. And it's called response shift. There's actually quite a lot of research on that. And we see that your normal is kind of like shifting as you are getting along the way in your disease journey. And it's very well known in psychology, in medical psychology, that happens a lot. So what you thought was normal like 5 years ago, maybe 3 years ago, maybe a year ago, you now have your new, like we call it like a new baseline, basically, of what is normal to you. Yeah. Thanks, excellent question.
Thank you for that question. Hopefully at the end of the session we'll have some room for some more, but thank you very much. Very good question, very good and comprehensive talk. Thank you. Next speaker is going to be Steffi. She's sitting right behind me, but she's going to walk up to the catheter, I think. I would like to introduce Steffi because she's talking about her own personal experience, which I think a lot of us and you can relate to. So we've got about 15 minutes to listen to Steffi, and then we can ask her some questions. And obviously we're around later as well. So the floor is yours.
Thank you. I'm sharing my own story, and I was diagnosed about 10 years ago. My first symptoms were puffy fingers, and I was not very. First I thought, would nothing be really serious, but then it didn't go away, and started searching for somebody who could help, and a Chinese doctor discovered that is something serious, and then I went to my normal doctor, and she already suspected that it's Scleroderma, and then I went to a specialist, and the specialist told me really horror stories when I visited them, or at least it was my feeling that it was horrible for me. I was always healthy and had maybe a cold, but never really something serious. And I was difficult. And then I was really soon looking for causes. So why it happened to me? Yeah, so many people why it happened to me. And in Germany there was by this time some books around, Krankheit als Weg. This means interpreting the clinical picture. So what might be the reason behind your illness? And then I started reading, and this was also the first idea to meet other patients, to find out, do we have something in common that might be similar? And then I also thought, what is really not working in my life maybe at the moment, and I had really, really tough stress with my partner by this point in time. And he suggested even that we do a psychotherapy to attempt to tackle the cause. And in Germany this is not paid by the beginning, so you have a long waiting time. So we paid it privately. And the doctor started with us, or the psychologist started with both of us, and then he focused on me, on my disease later on. But it was not a long psychotherapy. But I also thought, while this therapy, have I done something wrong in my life? I really thought about my whole life before, and where I have made maybe the wrong decision and went the wrong path. So. But then I spoke to other people a lot and found out nobody's life is really perfect. So everybody has maybe an illness, maybe some issues there, here and there, with friends and partner or family. So I calmed down a bit over time. But also helped, so the doctor, when I visited them, the specialist, said, I should continue working. I was thinking about doing a break. So, but he said, no, even if I had really a challenge to do all the doctor appointments and therapies, even if I worked part-time, so 3 or 4 weeks a day, it was really a challenge to manage everything from a time perspective. Yeah, but I should not think too much, so I had a full day. And 2 years later, the first time I took the opportunity to take 2 months off from work. And this really reduced on a long term even the stress of everyday life. I had a better time management, could be more focused on essentials. Because yeah, I had some time during these 2 months, and later I could manage myself a bit better. I reduced some therapies, focused on the ones what was really helping me. Not everything is helping me when I get, even I get it from the doctor. And I repeated this sabbaticals 4 times whenever I could. And this situation improved more and more, not just because of this taking off time from work, but yeah, I had more time to cope with the situation. And what I started immediately after getting diagnosed was gathering information, because the internet by this time was not very reliable. So you had also some terrible pictures and terrible stories. And then in Germany, it was at least possible to visit patient information days in hospitals. You could have some talks about different aspects of the illness, and even went to Switzerland. And I found out there are different approaches, and I have to find my own way. So if I choose this doctor, I might get this therapy. If I go to the other doctor, this is another therapy I get. And which was really a big help for me was my first FESCA World Congress in Lisbon, 2016. And the first time I was really happy to get comprehensive information, first-hand information, and I was really satisfied that I really had a good trust in it, and I was really, yeah, now I know, and now I could go my own way and was confident to make my own decisions. Yeah, and in Munich, I had also the luck to find a specialist who took the time to answer all my questions. This is also not normal or not everywhere. But yeah, this was really great by this time. But now he's gone back to Hungary. So no specialist available sometimes in some cities. And yeah, I have a close contact to other patients to discuss what is your strategy, what is your medication, and feeling a bit more safe also to see that people can grow old with this sickness. So it's nothing you will not survive maybe 5 or 10 years maybe. So this was also calming me down. And yeah, my approach to medication might be interesting as well. As I said, I found my own way, and this was to reduce cortisone and mycophenolate mofetil, what I got in the very beginning, because I had to. This was no choice. Really, I had really severe sleep disorders, so I really could not sleep over weeks, and this made me not. The short-term memory did not work anymore. So I realized at work I cannot remember what some other colleague told me the day before when explaining me something, and I didn't remember the details. So this is really difficult to deal with it. So it was like not functioning at work anymore. So I was really concentrated, but even so it was difficult. And yeah, I had to stop this MMF therapy first, and the cortisone I reduced over time in the next 1.5, 2 years. I stopped it completely. And then my specialist told me, okay, look for another doctor, because then I cannot be your doctor anymore if you don't take my medication. Yeah, and I found a fasting cure, or did a fasting cure in Berlin. Charité offers one. They say, okay, we try with this kind of sicknesses that you I had also something else from other countries, that there might be some switch if you try to somehow. It did not really work, but I got some hints how I can use alternative medication, like incense, and I don't use cortisone, but incense capsules now. And against the short-term memory, it was also a friend told me, saying, yeah, you can do something about it, use thebunin. So this is from the ginkgo tree, and it really helped me. I really had an improvement after 1.5 months taking it, so it was really helpful. And yeah, what is important in life, this is also something what may change if you have such kind of illness, that some things are more important and others might be less important. And yeah, I think the main things is the people around you, family, friends, and enjoy life every day, and whatever you can do. So for me, it's, yeah, I have luck, not much progress in Scleroderma, and I found out problems can be solved everyday life. I know my limits. Sometimes it's difficult, and I try to push it out, the limits to the. But yeah, it works somehow. I watch myself, and yeah, some things I cannot do anymore, like winter sports, or at least you can do, but it's maybe not the best. But yeah, I have done it in the past. I don't need to do it anymore. It's not everything you need to do. And yeah, I have a garden now and like gardening and making music with others. It's also possible, even if the fingers do not work this well anymore. But now I do not play guitar anymore. I drum. I'm the drummer now. Yeah, and what is so the final, what I want to say, keep moving is so my part, yeah, myself and others. I got involved in many things, what I wouldn't have done if I not have this sickness. And yeah, I lead a local support group in Munich and representing Francesca for the whole association in Germany. And yeah, I can still do a lot, also other things, and yeah, have new friends, new meaning in life is a little bit high maybe, but new priorities in life maybe. Okay, that's it on my side.
Thank you so much, Steffi, for sharing a very personal but probably also recognizable story. So thank you very much for that. Is there anybody in the room who's got a question for Steffi? Yes, I thought there might be. There's a lady over there, behind, yes, in the white top.
Je parle français, enfin, I'm from Belgium. I have the same trajectory, but now my problem is how to share that disease is lethal, how to share the end of my life, because it is that is waiting me. Is somebody who have an answer, because if I know how to share that, I will live better, maybe.
You mean that I share
you
share your story that you feel better afterwards? Or what was, I did not really get the question.
No, the disease is de plus en plus mal. Worse, worse, worse. You understand?
Mm-hmm.
How can I share, comment est-ce que je peux gérer ça to have in my mind a better life before the end? Because it's a lethal disease. You know it. No, you know it.
Yeah. Maybe I have the luck that it's not. Yeah.
It's in our mind, but maybe we can do something to change that and a better life before the end. So, today.
Yeah, live today.
And you want to know what I would recommend to. It's difficult, yeah. I mean, it's for everybody more or less. If you are sick or not, you want to try getting best out of the rest of your life, how long it ever may be. I think it's nothing special for scleroderma, really. And I'm not the expert. Maybe the specialist is coming up to me.
I think it's a very difficult question and not in this area maybe to be able to ask it, but let's talk later. Would that be an idea? Yes? Would you like to?
Yes.
Maybe later, yeah. We've got a professional who really has a good answer to this, I believe. So there might be lots of people coming. Yes, our next speaker, thank you very much, Steffi. Our next speaker is Francesca. She's from Italy. She's a medical doctor and rheumatologist, and she's going to give us her perspective on how mental health is or is not discussed in the consultation between the doctor and the patient. That's right?
Good afternoon to everyone. Thank you so much. First of all, I would like to thank the organizers for inviting me to this Congress. I'm very honored to be here today. And my talk is about a very important topic, is how doctors deal with mental health concern during medical consultation. And I'm Francesca Ingegnoli, I'm a rheumatologist. I work in a rheumatology unit in Milan, Italy. During my talk today, I will go through three main aspects. So first of all, we'll discuss about the burden of mental health symptoms in rheumatic diseases with a focus on systemic sclerosis. And then we will discuss about the patient perception of these symptoms and the clinician attitude toward mental health problems. So let's start with the first point, mental health problems. And the burden of mental health problems in rheumatic diseases is definitely higher than general population. And this graph is taken from a very recent study. And the author identified 30 main mental health symptoms. And they made a survey to patients with rheumatic diseases, 1,853 patients, including 63 patients with systemic sclerosis and healthy controls. And as you can see in this graph, the red bar, in this survey, the authors asked to mark symptoms that patients had experienced at least 3 times in their life. And so, as you can see in this graph, all these symptoms were definitely more frequent in patients with rheumatic diseases than the healthy controls. The red column are a patient, and the black column are the replies of healthy controls. So the range of neuropsychiatric symptoms experienced by patients is wide, and the burden is high in patients. And what about systemic sclerosis? And what we know is that the most common mental health symptoms are anxiety, depressive symptoms, fatigue, and sleep disorders. And these symptoms may be related to some disease-related factors. For example, the clinical involvement, lung or musculoskeletal involvement, they can be related to the worries about changes in appearance, scared of the disease progression, uncertainties about the future, and also to disease activity. So inflammation can support and increase these symptoms. And the presence of these symptoms influence the quality of life and impair the quality of life. So the mental health burden in systemic sclerosis is high. And what about the patient perception of these symptoms? And now I would like to bring my experience. In 2019, in Milan, we decided to decided to plan a study. It was a survey. It was an online survey. It was disseminated by Patient Association. It was anonymous, and we planned a survey divided in different parts. In the first part, we asked patients about diagnosis, about the age of diagnosis, and about the presence of different symptoms, such as arterial hypertension, diabetes, and also depressive symptoms, just to say yes or no. And then in the second part, we ask patients if they agree to complete a questionnaire. The questionnaire is the PHQ-9. 9 is a number of questions in this questionnaires. And this is a questionnaire used by general practitioner to screen the presence of depressive symptoms. And now I would like to show you the results of this study. We had 200 replies, and among these patients, 18 had systemic sclerosis. And the results are shown in this slide. So in the first part of the survey, when we ask, do you suffer of depressive symptoms, only 8.3% replied yes. But after, if we look at the score of the second part of the questionnaire, the PHQ-9, the majority of these patients had depressive symptoms, from mild or very mild depressive symptoms to severe, the 82%. So there is an impressive difference between these results, and these results, are similar in a patient in the 18 patients with systemic sclerosis. As I show you here, only 11% respondents reported to have depressive symptoms in the first part, but according to the questionnaire, the majority of them have mild depressive symptoms, but there are depressive symptoms. And these are the results of a very recent study. And in this study, 1,853 patients with rheumatic diseases were interviewed. And a patient, just had to report if during the medical consultation they were asked about mental health symptoms. And if they reported to the physician if they suffer of a major or minor mental health concern. And as you can see here, the majority of patients reported that they were not asked about mental health symptoms during medical consultation. But on the other hand, the majority of patients did not report about these symptoms to the physician. Now we move to the third aspect. This is this was the result about patient perception, and now we move to the last part, the clinician attitudes, because in the same study also clinicians were interviewed, 289 clinicians, and as you can see here, clinicians not always ask about. They not always ask about mental health symptoms, but the major problem is that more than 40% of clinicians did not report in their final medical report about mental health symptoms. The reasons of these results were, these are the potential reason of why mental health issues are not reported or investigated by physicians were, on the one hand, a limited amount of time for each visit. So there's the need to prioritize the urgent aspect, or even the increased administrative duties. But on the other hand, there is the lack of empathy, and the clinicians often reported that they have no or limited training and a knowledge in the management of mental health symptoms. So to summarize, mental health burden is high and wide-ranging in systemic sclerosis. And on the one hand, patients often underreported mental health symptoms to the physician, but on the other hand, clinicians often underrecorded and don't ask about mental health symptoms during medical consultation. And how to improve this situation, and this study, concluded that it's time to break this self-perpetuating cycle. And how to do this? And on the one hand, patients should have more confidence and trust physician and report if they have some problems, mental symptoms, anxiety or depressive symptoms or other symptoms. But on the other hand, clinician should ask about that and should report these symptoms in the medical report. And these symptoms should also be included in clinical studies, clinical research trials, and so on, just to understand properly the burden of these symptoms. So thank you very much for your attention.
Thank you so much. That was a very good talk, very interesting. Are there any questions from the room? Yes. Just a moment, because they need the microphone. Thank you. Like mine?
Does it work now? Yeah. Okay, so you mentioned that you the questionnaire was about 9 questions that you asked to the patients, but I didn't see the questions. I would be interested which 9 questions were that?
We use that questionnaire because it's a general questionnaire that is translating different languages, so it's a very easy and accepted questionnaire to screen depressive symptoms. There are 9 questions about, depression, sleep disturbance, mood, anxiety, and so on, different aspects of life.
Sleeping disorders and
we choose that because, it's the most accepted questionnaire to screen this problem. It's very easy.
Would you be interested in knowing?
It would be interesting to me, but
There's the 9 questions, and you have to reply how often do you suffer of these symptoms, and there's a score. So at the end, you will have a final score, and there is different score if you have mild, moderate, severe. That's why.
Okay. And I would also be interested to know, there's the medical congress at the same time. Do the medical the doctors also speak about this, I think, very important topic, because we know that stress is one factor that can accelerate the illness. Do the doctors speak also about this topic, like the mental health, and that they should, not they, but maybe that there should be also a specialist to look after patients' mental health? And is this a topic for them too?
Yes, so we know that, it is a problem, and there are, now lots of studies that included these symptoms, and so there are, some in the medical congress presentation and posters about that, and they started to be included.
If I may add something to that, there are now new recommendations for non-pharmacological care for people with systemic sclerosis and systemic lupus. And so there's recommendations also on non-pharmacological care, also mental health, but also exercise and that sort of thing. And in a different group, and Carina is going to talk about it later, we're trying to disseminate those to both patients and healthcare providers. So that way we can address this unmet need, really. So sorry for plugging that, but thank you. Are there any more questions in the room for Francesca? May I otherwise ask one question to you? I was wondering what we as people in the room can do to break that cycle next time we go and see the doctor. Should we bring this up or should we?
Yeah.
What do you think?
No, I think both patient and physician as well should ask more. Patients should report if they have this problem, because sometimes the doctors are, overwhelmed of everything and is, focused on some aspect, lung, joint, skin, and not always is focused on mental health symptoms. But on the other hand, the doctor should be pay more attention to this. Definitely.
We hope for an attentive doctor, but also maybe a self-conscious patient to sort of really prioritize. I think Linda might want to add.
I just wanted to add to that it may not be so easy for patients also. They may have a lot of questions. You may have a lot of questions when you go to your doctor. And there's, first of all, on my last slide, there was a resource on like how to speak about mental health issues to your doctor. And there's actually some of those like tools for doctors as well. So to really realize like what you can do. And one of the things is that you may want to think about like how you can prioritize your questions. So maybe you have like 6 or 7 questions, right? And there's limited amount of time. So as a person with a disease, when you go see your doctor, try to prioritize and also like help the doctors like set the agenda, because you're really busy. You're seeing a lot of people at the same day and you need to like check a lot of boxes also in the medical field. But if you as a person with scleroderma actually say like, today I would like to also talk about my mental health, just from the onset, that really can help set the agenda. And I agree with you that, doctors nowadays are much more open to it than back in the years, because you're more aware of what is important and how important mental health is. So there's tools online, you can find them on my last slide, but also if you look online yourself to get a bit of like training and maybe like practice, or bring someone who can help you set the agenda for your appointment as well, to make that a point of discussion in your consultation.
Well, wonderful. Thank you for that very useful tip. I think it would be great if we could have a coffee break and actually finish on time, wouldn't it? So should we do that? And then if you've got any more questions to us, we'll be around. So, but thank you very much for your attention. Thank you to our panelists. Please, an applause. And I hope you had a very interesting session. Thank you.